The next question is, does IV sedation not actually put someone into a sleep state like propofol does?
So the question is, the IV sedation and the propofol sedation, or what we call it as a deep sedation, is the same. So what we normally recommend, or what we normally say in our office, and we do a lot of IV sedation on a very regular basis, and we do some deep sedation on an occasional basis also. So the IV sedation is more like what we call it as a twilight, or a very more like a conscious sedation. So what that means is, if we are going to ask the patient to respond, they are going to be able to very well respond. Like, let's say if I'm going to tap on somebody's shoulder, hey Lynn, wake up, or hey Lynn, take a deep breath, hey Lynn, open your mouth, then she will be able to respond when she is getting a conscious sedation. Whereas if she is totally deep sedated, then she won't be able to respond to our commands as well as she does when she is going to have conscious sedation. So that's kind of the difference between what we call it as an IV sedation as opposed to a deep sedation. And these two sedation are completely different than the one that you get in the hospital when you are going to be put to completely asleep like a rock, and when you are going to have your abdomen open to have a surgical procedure done. That we call it as a general anesthesia. So those are the the differences between the three levels of sedation, which is the lightest one being the IV sedation, the next one is the deep sedation, the next one after being the general anesthesia.
Thank you very much.